Hi, I'm Dr. Matt Sweetin. I am the new Director of Care at Farleigh Hospice. I'm a consultant geriatrician, so an older person doctor by trade, and I've been a consultant geriatrician at Farleigh Hospital since April 2015, having previously worked as a locum consultant at Guy's and St Thomas's in central London, which is where I did a lot of my training. In the last year and a bit, I've been the Divisional Director of Medicine and Emergency Care at Brumfield, which has been a really fun role, if not slightly manic. And of course we had a pandemic CQC inspection and over 80 consultants to manage as well. So it keeps you busy on that job, but it's been a great way to get to know the staff, to work across multiple clinical areas. And also I still keep my own individual clinical practice up. I was a champion in clinical frailty and I was frailty lead across the region here in mid-South Essex. And I have a specialist interest in movement disorders in Parkinson's disease, and I still run Parkinson's disease clinics at the moment. So my passion and love for service change and development has come from my recent role as Divisional Director, which I'm very excited to now bring over and start a new chapter at Farleigh Hospice. So I'm Director of Care, that is my new role, and the title can sometimes, it's difficult to understand what it is, but essentially it's overseeing clinical services delivered here at Farleigh Hospice, but with a particular focus with strategy, with developing services in the future, and potentially, as you know, some reorganisation of clinical services, really ensuring that we provide patient-centred care for all of our patients across the region, whether they're in the north, the central, the mid of our county as well. So yeah, overseeing clinical services, supporting, pushing the Farleigh brand out there, and ensuring partnership working, not within just mid-Essex, but further afield, and particularly then driving through some of the operational changes that will happen over the coming months and years in Farleigh and how we deliver clinical care to our patients. I was particularly looking for a challenge in something called an outward-facing role. So as well as doing the operational delivery and delivering and managing and overseeing clinical services, which I have a passion for and love doing, I really enjoy the meeting people across the network, across the region, and actually even across the country, to share good best practice, to innovate and to deliver new services. And I think that had it all in that job, as well as all the challenges that come with any job really as well. And particularly just keeping my clinical eye, and as you know, I'm still going to keep being a clinician. I'm a geriatrician by background, and I will keep that up for a small period of time at Mid-Essex. So actually being a job-in clinician, but also supporting redesigning clinical services was something I was very passionate about. And a really big shout out to our supporters and volunteers as part of the Farleigh family, who really have kept us going during these 3 months. We have had hundreds upon hundreds of deliveries, from chocolates to PPE, from all kinds of exciting PPE made from all kinds of different materials. From those that have been continuing to manage some of our back shop operations, and even now as we start to our shops come back online, and the volunteers coming back in to support there as well. We value your time, we value your money, and we value your hard work and care for Farleigh Hospice. So thanks once again for helping to keep our clinical staff safe and to provide care for those patients that really need it in Mid-Essex.